NCLEX Repeated Questions 2026. For USA nursing students. A nurse is assessing a 32-year-old pregnant client at 30 weeks gestation who reports swelling in her feet and legs that increases throughout the day. Which action should the nurse take first? Correct answer is B. Measure the client's blood pressure. A nurse is teaching a client who has been prescribed warfarin. Which statement by the client indicates a need for further teaching? Correct answer is B. I can eat as much spinach as I want. A nurse is caring for a client with heart failure who reports shortness of breath and edema. Which assessment finding is most concerning? Correct answer is B. Crackles heard on lung auscultation. A nurse is assessing a 6-year-old child with asthma. Which finding indicates poor asthma control? Correct answer is B. Frequent nighttime awakenings due to coughing. A nurse is caring for a client with schizophrenia who is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Correct answer is C. Validate the client's experience of hallucinations. A nurse is preparing a client for surgery. Which assessment is the priority before administering preoperative medications? Correct answer is B. Allergy history to medications or latex. A client with heart failure is starting IV furosemide for acute pulmonary edema. Before administering the medication, which assessment is most important for the nurse to review? Correct answer is A. Recent serum potassium level and blood pressure. A postoperative client on a PCA morphine pump reports severe pain and is very drowsy. Respiratory rate is 8 breaths per minute, and oxygen saturation is 86% on room air. Which action should the nurse take first? Correct answer is C. Stop the PCA, stimulate the client, and prepare to administer naloxone per protocol. A 55-year-old client with type 2 diabetes and obesity is admitted with a blood glucose of 780 mg per deciliter, dry mucous membranes, no ketones in urine, and normal arterial pH. These findings are most consistent with which condition? Correct answer is B. Hyperosmolar hyperglycemic state due to insulin resistance. A client with liver cirrhosis develops confusion and hysterexis. Which lab result does the nurse expect? Correct answer is B. Elevated ammonia. A client in labor suddenly develops dyspnea, hypotension, and cyanosis. What is the nurse's priority action? Correct answer is B. Administer high-flow oxygen. A client with cirrhosis develops ascites and confusion. Which order should the nurse implement first? Correct answer is A. Administer lactulose. A client receiving 4 morphine develops a respiratory rate of 6 breaths per minute and becomes unresponsive. What is the nurse's priority action? Correct answer is B. Administer naloxone. A patient is receiving a high dose of opioids. Which intervention prevents overdose? Correct answer is A. Monitor respiratory rate closely. A client with Guillain-Barré syndrome develops respiratory distress. What is the nurse's priority action? Correct answer is A. Prepare for intubation. A nurse is caring for a 72-year-old client with chronic atrial fibrillation who takes warfarin daily. The client's INR is 4.8, and the client reports new bleeding from the gums and small bruises on the arms. What is the nurse's priority action? Correct answer is A. Hold the next warfarin dose and notify the healthcare provider. A client with a spinal cord injury above T6 develops sudden hypertension, headache, and diaphoresis. What is the priority nursing action? Correct answer is B. Sit the client upright and loosen tight clothing. A client with diabetic ketoacidosis is receiving IV insulin. Which intervention is the priority? Correct answer is A. Monitor for hypokalemia. A client with pneumonia is receiving IV antibiotics. Which assessment finding requires immediate intervention? Correct answer is A. Rash and itching. A nurse is caring for a client post-thyroidectomy who reports tingling around the mouth and fingers. What is the priority action? Correct answer is B. Notify the provider and prepare to administer 4 calcium. A client receiving TPN develops dyspnea, chest pain, and tachycardia. What should the nurse do first? Correct answer is B. Clamp the catheter and place the client on the left side. A nurse is preparing to administer IV vancomycin to a client with MRSA pneumonia who has chronic kidney disease. Morning labs show BUN and creatinine significantly elevated from baseline, and the client reports decreased urine output. What action should the nurse take first? Correct answer is B. Hold the vancomycin dose and notify the healthcare provider of lab results. A client with myasthenia gravis is receiving pyridostigmine orally. The nurse notes increased salivation, abdominal cramping, muscle twitching, and bradycardia shortly after the last dose. What is the nurse's priority action? Correct answer is C. Hold further doses and notify the healthcare provider of possible cholinergic crisis. A nurse is caring for a client with a chest tube when the tube becomes dislodged. What should the nurse do first? Correct answer is A. Cover the site with petroleum gauze. The nurse is educating a client with newly diagnosed type 2 diabetes about insulin resistance. Which explanation is most accurate? Correct answer is B. Your body produces insulin, but the cells do not respond to it effectively. A client with a stroke has right-sided weakness and difficulty swallowing. What is the nurse's priority intervention? Correct answer is D. Elevate the head of the bed during meals. A 68-year-old postoperative patient with a history of COPD and obesity is receiving oxygen therapy. Which action should the nurse prioritize to ensure patient safety? Correct answer is B. Monitor the patient for signs of CO2 retention. A nurse administers a medication to a patient with a known allergy to morphine. The patient experiences facial swelling and difficulty breathing. What is the nurse's immediate next step? Correct answer is A. Call for assistance and prepare to administer epinephrine. A patient with a history of stroke is being discharged with a prescription for a new anticoagulant. Which teaching is essential for patient safety? Correct answer is B. Explain the risk of bleeding and the need for regular IN/R monitoring. A postoperative patient has a drain in place and is at risk for infection. What is the most effective intervention to reduce infection risk? Correct answer is B. Cleanse the drain insertion site with antiseptic at least once daily. A patient is at risk for deep vein thrombosis. Which safety measure is most effective for prevention? Correct answer is A. Apply sequential compression devices and encourage leg exercises. A patient is receiving IV hypotonic potassium. Priority assessment? Correct answer is B. BP and heart rate. Select all that apply. Proper patient identification before medication administration includes. Correct answer is A, B, C. A patient with a central venous catheter develops fever, chills, and redness at insertion. What is the first priority? Correct answer is B. Discontinue CVC and notify healthcare provider. Postoperative patient at risk for aspiration. Priority intervention? Correct answer is A. High Fowler's position while eating. Select all that apply. Fall prevention interventions include. Correct answer is A, B, C. Patient prescribed high-dose corticosteroids. Key teaching? Correct answer is A, monitor for infection. Patient anxious about anesthesia. Best response? Correct answer is B. Explain procedure and anesthesia. Select all that apply. Preparing a sterile field. Correct answer is A, B, D.